Hey guys, welcome back to another episode of Nursing Uncharted. Today I'm so excited because I have a dear friend of mine with me today, and we're going to talk about a new exciting branch of nursing that has kind of been kicking off, kind of crazy right now. So I'm super excited to kind of dive deep into that and get your perspective. So, first off,
Yeah.
why don't you introduce yourself to everyone?
I'm Ashley Reeder, aesthetic nurse Ashley on Instagram and in my office space. And yeah, long ago, I've actually had a couple of travel nurse contracts and I've worked inside the hospital space. So I started inside the hospital space long ago. I started in Arizona in a high acuity step down, kind of like mini ICU unit, cardiac unit. And then I took a travel nurse assignment to make my way out to San Diego and I went onto a neuro unit. And then I ultimately ended up doing, well, first of all, I feel like many nurses can relate to this and that we usually hold at least two jobs at one time. So, up until this point, I have always had multiple nursing jobs at one point in time. So I also took a job doing interventional radiology outpatient when I came to San Diego, and then transitioned to per diem and floating to all of the hospitals within the hospital system here in San Diego. And then also took a break from aesthetics during the COVID crisis and did two COVID crisis assignments. I did one in New York and one in Riverside. And then yeah, I just had this opportunity networking, and which I think I recommend to all new nurses in general and anyone trying to get into aesthetics, networking and just meeting people along the way. I stumbled across a really amazing opportunity to be in a more independent space and to really kick off my aesthetics. I had worked at a couple aesthetic offices as well, part-time, and back then it wasn't as popular for sure. I feel like the support was a little less from my nursing friends, kind of like a fun thing on the side to do. Kind of weird, kind of seems superficial to people. And it really took off. And a lot of those friends have actually asked me how to get into it now, 8 years later, which is really crazy. I feel really
Yeah.
grateful that I had the opportunity to get into it when I did. And it really, really helped me get to where I am.
Yeah, and you said, I think when we talked earlier that the
Yeah.
interventional radiology, there was a
Yes.
nurse practitioner there.
Yeah.
Is that right?
Yes. Yeah.
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 So,
That
like,
ultimately,
how did that
yeah.
happen? Like, how
It's
does radiology
so
transition
crazy.
to
I
Botox?
know. And this is where the networking comes into play. And I feel like I just skimmed over this and missed this completely. But my transition was working at this interventional radiology office, and one of the NPs was doing sclerotherapy. And she got me started doing that. And she just said, I think you would really love doing aesthetic treatments. She was also doing that on the side. And I didn't really even know what that was. She kind of told me, and she said one of her physician friends had a nurse of 7 years who was leaving, and he was looking for a new nurse to inject. So I was kind of not pushed into that, but really, again, grateful because someone saw that I could fill that role really well. And so, yeah, I went, and I remember when I applied, I thought I'll just do part time. They wanted to offer me full time. I'm like, no, I'm keeping the hospital. Like, this is my bread and butter over here. Like, let's do part time. And then I ended up loving it a ton and ended up transitioning eventually into aesthetics. But that's how it fell kind of into my lap.
Nice. Okay, so like, let's say I want to make this step. Do you like, because you now, well, hold on, before we get there, let's talk about how you went from, because it was a med spa. We're both considered med
Yeah.
spas.
Yep, med
Yeah.
spas.
So
Yes.
you worked in a med spa and then you transitioned. Now we didn't
Yeah,
even talk about that yet. You have
I
your
know.
own
Yes.
practice. Like that's so
Yes.
cool. So
So,
how,
yeah.
yeah, like how did that happen for you?
Yeah, that happened also through networking and through an angel that reached out to me on social media, who's now one of my dear friends. And the company that I'm partnered with, I am in an independent space, but I'm partnered with my medical director. So I operate under him and with him alongside him, Dr. Lofkus. And the company is Illuma, and they have totally just helped me become who I am today in my business space and able to really help with my patients and just having an impact on them too. So more authentic space, more autonomous. And so, yeah, that's what happened. Basically, I was reached out to on social media about this new business model. And so I ventured into my own space, and it's been 3 years now. And at that time, and I have a funny story with you, actually, when we first started. But at that time, I was in a really small space. And then this past December, I moved into a bigger space. So grateful. It has 3 rooms. I actually have an amazing facialist who's partnered with me, and she's
Yay.
working out of one of the rooms. And then I'm using both rooms, going back and forth, bringing on another assistant. So we'll have 2 people with me, and just come a long way. And it kind of goes to show you just there are a lot of industries that can be a little toxic, and especially in the medical field, when you think about nurses and strikes and all kinds of things where nurses aren't valued. And so this new model is really just making waves in our aesthetic industry because it gives more value to nurses and injectors who have such an impact and such a direct relationship with their patients. I'm able to just have a much more authentic relationship with my patients and give
Mhm.
better care because they're coming to see me and we have a relationship. They're not coming to the med spa. And I've learned about kind of just the dynamics of those med spas. So, anyways, but
Yeah.
when we first, because we've been friends for a while since you moved out here too.
It's been 5 years. It'll be 5 years. I was literally thinking about that. Like I said, walking to the gym, I'm like, this is crazy that, just
Yes.
randomly ran into you at a party at your house, remember? Like Halloween?
That's crazy.
Yeah.
I
And like
know.
that's how this whole
And
thing.
Laura, bless her,
Yeah.
she introduced us.
Yes.
Love her. Just went to
I
her
know.
wedding, but
I know I saw.
so pretty. But you helped me. Oh my gosh. You know, another thing, or when we talk about business, it's a lot of hard work too. So it's not, I feel like as injectors, we make it look really pretty and really fun because it is. And I've had this growth and I've moved into bigger space, but I've worked really, really hard to get here. And one of those things is community outreach and just doing things that are kind of uncomfortable. And we did that pop up at the gym. Do you remember you came with me?
Oh my gosh, I forgot
You
about
were my
that.
helper. Yeah,
We were
I
doing
had.
cartwheels at the gym.
Yes, we were trying to get patients and we were doing giveaways, and you were so good. You were walking up to people and you were recruiting patients. You were my right-hand girl that
Oh
day.
my
That was
gosh. Girl, I forgot about that, but that's
that's so
so
funny.
funny. Yeah. Yeah.
I definitely don't forget about that because you
Oh.
and one other friend did that, and that is time out of your day. You didn't get anything for that. Like that was really sweet. So
Yeah.
anyway,
Well, you're welcome. I mean, I just thought of it as like a fun
yeah,
networking thing for me though
I,
too, like just
I
meeting
know.
people, you never know. I was new to San Diego, so
Yeah,
just hoping to make friends out of it. So
yeah, yeah.
you're welcome, but also thank you for thinking of me. I mean, that was so fun. I completely forgot about
That's so
that.
funny. That's so funny. I
Well,
definitely
I'm
will.
yeah. And I mean, you've really touched on this a lot that it's all about networking. And
Yeah.
that's we do find lucks every once in a while, but that doesn't say that there's not hard work behind it. And I know this because I know you personally, but you've worked
Yes.
hard for those networking opportunities.
Yes.
So,
Yes.
a lot of people think, well, how do I get into this now? Because it has kind of blossomed into something
Mhm.
bigger. And
Yes.
what social media probably plays a huge role in how we
Yes.
get new
Yes.
patients and the
Yeah.
success of that. But
Yes.
what could be someone who is now working in a med spa, like what and wants to transition to this more independent
Yeah.
business owner as a
Mhm.
nurse, which is pretty freaking cool. Like how do
Yes.
you start that networking? What
Yeah.
tips can you give? Like what did you do?
Absolutely. Absolutely. I mean, there are meetup events and just getting to know you know, reps for your trainers and reps inside the med spa space and getting to know people in your industry, going to trainings, you do need to pay out of your own pocket to go to many of these trainings that we go to, but it's crucial for safety and for all those things. But that will help open the window, meet people, get some connections going. And yeah, it's just a whole another thing, this whole independent. And
Yeah.
it's crazy because there's so many things RNs can do. And I remember back when I was working in the hospital space, any new nurses that would, or anyone in nursing school that would ask me, like, should I be doing this? I always say yes. And I know nowadays people sometimes veer the other way, but I always say yes because there's so many opportunities for nurses in general, and it's only getting better. And just look at the aesthetics field in general,
Yeah.
because it wasn't this big, years ago. So,
Yeah. Yeah,
yeah.
definitely. Definitely. I feel like we dove right into this and talking about where you
Yeah.
are and all this exciting stuff, but let's kind of take it back a little bit and define what aesthetic nursing
Yeah.
truly is. Like what you are as a nurse allowed to do
Yeah.
and just kind of the structure of that, because you did mention that you work under the
Yeah.
supervision of a physician.
Yes.
So, let's kind of talk about that because I'm sure people are listening have no idea what we're
Yeah.
even talking about.
Yeah. And so, yeah. So aesthetic nursing, it includes anything injectable, anything with needles, medications, things like that. It's totally separate from estheticians. I think a lot of times people that are outside of the medical field will ask, are you an esthetician? And I'm like, no, that's not. So it still is a gray new area. It's like,
Yeah.
no, I'm not. A lot of estheticians, but it's totally different. And so in the United States, you have to be a registered nurse to inject anything aesthetics. It's different in some other countries, I know, and I know they're making changes to that because I feel like it's the Wild West in some other countries. But yeah, so here I legally operate alongside under the supervision of a medical director, and also in addition to NPs and PAs who help provide my good faith exams. So that's we're in accordance with California medical clearance and all those things. And so with that and with that prescription guidance, I'm able to operate kind of in an autonomous setting with my patients.
Yeah, I just
Yeah.
think that's so incredible because a little bit of my background, I worked in a plastic surgery clinic before I started traveling
Yeah.
back in Pennsylvania, and at that point, nurses were not allowed to do that.
Wow.
Yeah,
Yeah.
it
And
was
well, it's
just
also different every state. Every
yeah,
state's different, which
yeah.
is,
So I don't know like where Pennsylvania is
yeah.
now, but at that time, so coming to California,
Yeah.
meeting Laura,
Yeah.
then knowing that she did her injections, I'm like,
Yes.
wait a second, like what mind blown moment. Like, what is this? So it's just extremely interesting to me, I guess
Yes.
to say
Yeah,
the least. Just
it is.
and a huge pivot in mentality too, because I was told for so long working in a plastic surgery office, oh no, this is only physicians and PAs.
Yeah.
So then being like, wait, I could
Yeah.
personally be doing this. I just think
Yeah.
that that's really, really
It's,
amazing. And with nursing, we're roughly the same age. We roughly
yes.
have the same amount of nursing experience,
Yeah.
and we entered into this around the same time. So we've seen the changes, and
Yes.
it's over a short amount of time, in my
Mm-hmm.
opinion,
Mm-hmm.
the changes that have happened in healthcare, especially with nurses. So we're seeing burnouts, we're seeing frustration, and just never in my life did I think as a nurse there's the potential to have a
Mm-hmm.
business and to
Mm-hmm.
work
Mm-hmm.
independently. Granted, yes, you
Yes.
are still being
Yes.
supervised. You have a
Yes.
physician prescribing. You're not
Yes.
working out of what is legally your scope of practice, but you
Correct.
have those relationships and that independence and a beautiful studio that with
Yeah.
3 patient rooms. I just think that that's so incredible and eye-opening and motivating to nurses
Thank
who
you.
potentially could be feeling stuck in what we do, and just having that's why I was really, really, really excited when I got this opportunity to do this podcast. You were one of the first people I
Thanks.
thought of because
So
you've,
sweet.
yeah, I mean, one, I love you, but like
I love
on
you
the
too.
other side of that, you've hustled as like like in sales, in business owning, and in your medical profession. I just think it's pretty incredible what we can do as nurses, and this is such hopefully an eye-opening experience for the listeners. And just
Yeah, it's honestly, thank you for saying that. And it's so funny because I feel like this is just what I do. And I like, it's just part of me. And like all those things, I've worked really hard to get here. And I always want to remain kind of in my own lane and just remember the importance of nursing, which I do. And, just that's why I love it so much because I have an impact on patients. That is obviously it's not life or death situations anymore. However, I've had patients all the time cry in my chair, share things with me. I wholeheartedly am still operating as a nurse. And so that is really meaningful to me. And that's how this is so fulfilling to me. And, you kind of have a bit of imposter syndrome because I'm like, wow, it's just wild. Every day I'm pinching myself. So thank you for saying that about my space and everything, because I've worked hard to get here and
You have.
I kind
And
of
yeah.
forget. Yeah. I'm like,
Yeah.
oh,
Yeah.
and even with training, so I train now for Allergan as well. And that's so fun for me. And that also speaks to our nursing hearts because all we do is educate all day long
Yeah.
as well. So I'm just having fun. I'm like, I'm getting paid to do this. This is so fun. I'm teaching these new injectors and not even just new injectors, all kinds of injectors. And, but it is kind of like, oh, I'm the one training. Interesting. Like,
Yeah.
oh,
You
I'm the one that's answering
you
the
forget.
phone.
And I think that that's a
Yes.
nursing thing. We do what
Yeah.
we do because we love to do it and we know how to do it and we have
Yes.
confidence in what we're doing. But then you take a
Yes.
step back and you're like, wait, I just did that.
Yes. I know.
you know you
Exactly.
forget, and you have
Exactly.
to give yourself credit when it's due. And I think that you're an example of what hard work and dedication
I
can
like to,
can turn into. And I
yeah.
can't say that enough because it's really inspiring. And
Thank
I'm
you.
proud of you as a friend, that
Thank
you've done
you.
what you've been able to.
Girl.
Yeah.
Yeah, I think as I've been doing this and as I've been growing professionally and just as a human being and as a woman, it really has hitting me how much just living our lives the way we do and achieving these goals inspires people that watch us and just kind of being who we are. And because I sometimes I'm like, how can I better illustrate that or help others? But sometimes just doing it is inspiring enough. So I try to remember that too. So thank you.
Yeah, yeah, of course. And, just the whole education and
Yeah.
training portion that you're doing right
Yeah.
now, you're paying it forward. And that's what we
Yeah.
do in nursing. And I think
It
that that's
is.
really special that you can do that even in this branch of nursing that is very specialized and
Yeah.
does take very, it takes a lot of training and intricate training. I mean,
Yes.
we kind of skim over a lot of things when it comes to aesthetics because we think about, ooh, I want my lips done. Ooh, I don't want the
Mhm.
wrinkles. Ooh, I want this
Mhm.
or this. I don't want to see my veins, whatever it may
Yes.
be. But at the end of the day, you could put a needle in the wrong place. So you have to
Yes.
know your anatomy. So
You
you
do.
still have to be a nurse. You
Oh
still
yeah.
have to have that education and know, what nerves are
Yeah.
there, blood vessels are
Yeah.
there. I mean,
Absolutely.
we had a little moment that one time where we had to kind of take a break and
Oh my
stop.
gosh.
You remember
Yeah,
that?
that's
Yeah.
right. Oh my
Yeah.
gosh. We
Yeah.
both didn't remember these stories we're telling. That's so funny.
Yeah, but no,
But
but it
yeah, so
happened and you knew
yeah.
enough
Yeah.
to stop because I
Mm-hmm.
said, "Oh, that feels funny." And you're like,
Yeah.
"Wait, no. We don't want it to feel funny, so let's take it out." And
Exactly.
yeah, and I think that
So that's it. That's aesthetics. That's for sure. That's what it looks so fun and it is, but it is very involved and it takes
Mhm.
a lot of anatomy knowledge. It takes a lot of skill set and a lot of experience, just like that, to know what to look for. It takes a lot of treatments to get to the point where you recognize things and so yeah, so aesthetics, it looks fun. And that's kind of also what I tell nurses as well, because it's like, let me just do this.
Yeah.
It takes a lot. And I also think it's so crucial. And I think some nurses might not like this, but I think it's so important to work in a hospital space before going into aesthetics. I think it built me as the person I am today. It paved the way for my bedside manner.
Yeah.
It just helped me so much. I can't really see how many nurses can be injecting without having some kind of clinical background because it helps so much. So that's the other advice I give to new nurses as well. I just think it's so important, so important.
Yeah, I have been hearing a
Yeah.
lot of people say, "Oh, I want to be a nurse."
I've had this happen a couple times. A friend of a patient, so cute, young girl, asked me, "This looks so fun. How do you get into this?" And I was like, "Oh, that's so sweet, you know." I said, "Well, you have to be a nurse to inject." And I could see it, just the wheels turning, and she's just like, "Oh no." And I said, "Sometimes that's a 2 year wait to get into the program, and then the program's 4 years, and then you need to have some experience at the hospital." And then I could just see her, not to like disappoint or crush anyone's dreams, but I could see her think, "Oh, so you really, when you see it and you see these cute injectors, you're like, this looks so great." You're like, "Oh, they have a medical background. That's
Oh, they had to
crazy."
work to get here?
Yeah.
What?
So how'd you
Yeah.
start this?
Yeah, and I
It's
do
so
think
cute.
that that's not an ignorance in a bad way, but
Yeah.
it's an ignorance of knowing
Yeah.
exactly what you're
Yeah.
doing and what your title is. You're not just
Yes.
Ashley, you're
Yeah.
a nurse, you're an RN, you have a
Yeah.
license, you have an education, and you have experience behind you. But to the general population, you're just making people
Yeah.
feel pretty. But
Yeah.
you are. And something I thought of when you were telling the story of, yes, it's not life and
Yeah.
death, but you're changing lives. Like I think about people who have, like scars. Like I know I have a small scar on my lip, so there's a little
Mhm.
like asymmetry, and just making those small little tweaks,
Yes.
because we
Yes.
we look at ourselves in the mirror, especially as women.
Yeah.
We look at ourselves and we critique and think about what
Mhm.
we can change, and sometimes it's unrealistic, but these little tiny things that we can do to make ourselves feel
Oh yeah.
better
Oh
physically impacts us mentally. And that, I think that mental health is just as important, if not more important than physical health. And if we can help that, which you are, someone who's been insecure about something that now is affordable for them,
hmm
before
hmm
10
Yeah.
years ago, when you think about Botox, you had to wait for an appointment. You had to see a plastic surgeon. You had to, get that consultation. You had to fork out all this money, and I'm not saying, oh, this is a cheaper way to get it done, but it's an easier,
Yeah.
safer, way
hmm
to have access to these
Yeah.
treatments,
I
and
love that you said that. Thank you for saying that. Honestly, the amount of women that have come in and just, it's therapeutic coming in and treating yourself. The amount of women that come in that haven't been treated in years, have gone through motherhood and all these things, and then seem fine during the consultation, during the treatment. Then afterwards, when they see themselves, they cry and just, it's kind of unexpected sometimes. And they will verbalize that they just haven't treated themselves in years. And this is like the first thing. So it is, mental health is huge, especially for women. Well, for both, but I mean,
yeah,
just in my space. And men too. I treat a lot of male clients, and that's a
you
whole
do. And
nother
I
thing
love that.
because we're tackling that stigma for sure,
Yeah.
because men need to look good too, or feel good. I
Yeah.
shouldn't say look good, but feel good.
Mutually.
But yeah, so it's so rewarding. I can't even tell you. And just the things that we do as an injector in the room, it's pretty wild because yeah, we are helping to create a treatment plan. We're keeping the patient comfortable, we're administering the treatment, we're talking them through that, we're talking to them about therapy type of things, that you would in a salon as well
Yeah.
sometimes. But ours is a condensed appointment, so it's 15 minutes to an hour, and we there's just a lot going on in that time. And you also then have the medical knowledge to be watching things while you're doing that, while you're talking to the patient. It's
Yes.
really fun and it's rewarding in that way. So it is actually kind of, I know a lot of nurses say, oh, it must be, feel so nice, like so nice out of the hospital, but it is fast paced in its own way, for
Yeah.
sure. It's definitely its own little thing.
My
And
brain kind of wandered there for a second because when you're like, "Oh, I just sit there and watch them talk," and I'm thinking, "Oh, you're probably evaluating
I
how they
am.
move and where that nerve is and where that vein is."
Yes, I totally am. And it's kind of like a skit it's authentic and it's real, but they come in, the patient, and I'm getting them to animate. I'm asking them questions. I'm making jokes so that I can see them. So it's
Hmm.
kind of wild. So that's again why I do think you need bedside experience because it
Yeah.
helps so much with that. And I held on to the hospital for a long time. I held on to the hospital even when I was doing this. I had my per diem contract was so small too. I don't even remember what it was, but I remember I had called out sick the last 3 or 4 days that I had to work. And it was probably like 4 shifts a month that I had to work. It wasn't even much at all.
Yeah.
Anyway, so I told myself I would hold on to it because that was part of me. That was really bittersweet for me. That, kind of formed who I am today. And so, but it was all meant to be, and it was all good things, and I'm happy to be where I am. But yeah, I held on to that hospital job for a long
Yeah.
time.
It's like a security blanket, though,
It
you know? It's
was.
like I always have this to fall back on.
Yes, I know. Or
Yeah.
just having multiple jobs. I'd always had more than one, always.
Wow.
So yeah, but yeah.
Yeah. And I mean, but look, it's that moment in your life and in your career when you're able to look at what you have and
Hmm.
be like, this is
Hmm.
enough, and this is
Yeah.
more than what I expected it to be. So I can now put everything I have into it, which I think
Yeah.
so it's just so cool. Like I
It's
know I
so great. No,
yeah.
for any field too, for any specialty. I
Yeah.
love hearing stories, especially from my nurse patients, where they've gotten to where they want to be and they're fulfilled and they love what they do, or they've transitioned out of the ER and now they're in labor and delivery and they're just so happy. It's a beautiful thing,
Yeah.
definitely. And
Yeah, I
I think
think
there's more than enough room for aesthetic injectors. There absolutely are plenty of patients to go around. It's only growing from here. I think that if it's something that a nurse wants, he or she should definitely do it. And yeah, I don't want to discourage that. It's a lot of work too.
yeah, well, you need to give it the credit that it deserves. It
Yeah.
deserves hard work, and it's not just an easy job, right? So, it's important to say all these things and have people and the nurses that are listening to this know that it's serious. It's not just a lighthearted, oh, they took the easy route, and they're
Hmm.
just doing
Hmm.
this. No, there's a lot of work that goes into it, and it's very intricate. And
Yeah.
I don't I don't know. And if you don't feel like you want to touch on this, that's totally fine. But I'm just thinking
Yeah.
back with my experience, what I've seen.
Yeah.
I actually saw someone suffering from an eating disorder come in
Okay.
and want to have
Hmm. Hmm.
filler because she was
Yeah.
not
Yeah.
happy with how her face looked due to
Yeah.
this, underlying
Hmm.
disease that she had. Do you ever encounter anything like that and have to say
Yeah,
no?
absolutely. I think being
Yeah.
able to say no is one of the most crucial parts of this position. I think that a lot of people, especially in this day and age, have some type of body dysmorphia. And I know that we all have little insecurities. And you mentioned scar on your mouth. I would say I have many, many patients that come in just with childhood scars around their mouth or around their eye. And but yeah, I have said no before, definitely, and I've had that hard conversation with people. You have to know when to tell someone no, and the sad part is they'll probably find another. This is why it's so important to train and for us to elevate the industry as a whole,
Mhm.
because they will probably find somewhere to go that will just fill it for the money, and probably don't have a lot of experience. We'll just go ahead and do that for her because that's what she's requesting.
Yeah.
And then she'll have problems later down the line when she's not happy with how they look, or, when her health status may change, stuff like that. So definitely and that's
Yeah.
part of nursing too, having the hard conversations
Right.
and all that. Yeah.
And I think, like you said, not just even the physical anatomy part of it, but just having the experience of how to have those difficult
Yeah.
conversations with people is you get that through patient
Yes.
care. It's more, I mean, you're in the hospital because you're sick. It's not a happy day that you're
Yeah.
seeing us, right? So most of the conversations we have with patients are the difficult conversations,
Hmm.
the sad conversations. For me, I'm neonatal, so I
Hmm.
have to like the parents will walk in after something horrific just happened and
Hmm.
I don't have, it's not who I am to be like, hold on, let me call the doctor who's busy and make the parents wait. So sometimes I have to open up that can of
Hmm.
worms and have that, well, actually, this just happened. I want you to know, but I'm also going to get a physician to talk you
Yeah.
through that and the next steps. But you have to be able
Yeah.
to stare difficulty in the eyes and
Yes.
handle it.
Yeah.
And, you're right. And that's what's sad is that they have the opportunity to go to another place who
Hmm.
probably might not be licensed to do what they're doing and,
Hmm.
go get those treatments. So, it's hard, but it's so, so, so important to
Yeah.
be able to have
Be
that
able to do that. And I
experience.
do, I agree. I think hospital nursing, any type of clinical nursing like that helps you so much with those hard conversations and to just be confident in your treat and what you're doing,
Yeah,
confidence in treating the patient and
that's
deciding what
very
not to
true.
do.
I don't want
Yeah.
you coming at me like,
I know. I know.
way to go.
And it's kind of funny because there's no other medical field where patients try to self-dose. So that's another thing. So we have to be able to kind of cultivate this environment and medical spas and practices like mine where we're guiding the treatment plan and we're not allowing the patient to guide the treatment plan, having them come in and ask, I want cheeks, I want lips. We need to start looking at the face collectively so that we can have natural results. And so the patient is not dosing themselves with the number of units because we don't go into another medical practice and say, you know what? I actually am gonna do a lower dose than that. I actually don't like what you recommended. So for some reason in aesthetics, because it's that kind of gray area and because it has to do with beauty, I think it started off like that. And I think now it's kind of created this environment where patients come in asking and requesting for a certain number of units, things like that. And so in educating and just being in my space with my patients, that's also the other battle I work against. And I feel like we're all elevating it as a whole, hopefully,
Hmm.
but that's just as it's growing as well. It'll get better, but that's another thing I've seen that is kind of interesting.
Yeah. Well, talking about it growing, I mean, you've seen so much growth from when you've started till now. What
Yeah.
do you see? Like, what do you
Yeah.
envision? I mean, you probably have some insight because of all the
I
training
do.
and,
Yeah.
the companies that you work with are very well known and
Yes.
established. So you know what's up and coming. So we don't have to disclose that. But, what do you see for the nurses in this industry? Like, what do you
Yeah.
envision?
I see so many great opportunities for nurses where they're heard, where they're compensated appropriately, valued, and also just creating better results for patients, more natural results, the field
Mhm.
itself just getting improving in that way. And I see the entryway into aesthetics changing because it is becoming more popular. There is a higher demand. There's a higher number of patients. So we almost need to like keep up with this higher demand and this growth. So there will be faster ways to get into aesthetics. Initially, it's like, networking, finding a medical director that's interested and operating under them, getting training through through Allergan or whoever. But now I feel like there will be universities and things where nurses can go get training quicker, and there are certifications now, but that doesn't automatically give you the experience
Yeah.
really or give you a position. So I see that changing because there's such a high demand. Yeah,
I'm thinking like just a
yeah,
university. I mean, it would be
yeah,
after nursing school, obviously, right? I mean,
yes,
yeah.
yeah.
And
Oh
then
yeah,
just
yeah, yeah, yeah,
going into this specialty and just having,
yeah,
I mean, if you think about that, when you enter the bedside as
yeah,
a new nurse or a transition to a different specialty, you're in like 4 to 6 months of orientation.
yep,
So,
exactly.
that's basically school. So to have like a
Yeah,
school or university, let's say,
yeah,
specializing in the
yeah.
pathway of aesthetics will
Pretty
really
cool.
just make this better and safer
Exactly. It's
and
all about
streamlined.
safety.
Yeah.
Streamlined safety and just, yeah, structured, you
Yeah.
know?
We like
Yeah.
structure.
Yeah, exactly. Because
Yeah.
there's definitely plenty to go around. There's definitely a need for nurse injectors. Absolutely.
I'm happy to hear
Absolutely.
that. I'm happy to
Yeah.
hear that because a lot of, I think some people are thinking, even my mindset was thinking, is it too
Yeah.
late? Is it too late to get in the game? You know, because sometimes it's like the
Yeah.
sooner
Yeah.
you get in, the better. But,
No.
it's good to know that it's more people know
Yes.
about it. It's
Yes.
entering into households that never really thought this was an opportunity. And so that's really
Yeah.
interesting and exciting to know that there's growth to come.
There
And yeah,
definitely is. Yeah, there absolutely is. It's not too late at all. Aesthetics is just getting going. It's just getting better. It's absolutely. And to get to a point where you're a little more independent with this newer business model, you do
Mhm.
need to have clientele. You do need to have experience. You do need to have experience with, potential adverse events and things like that. So, but it doesn't mean that it's not doable and that it's not going to keep growing and all those things. Yeah.
Yeah. Yeah. I kind of like forgot we were recording and I thought we were
I
doing
know.
a
I
conversation.
I
So
know.
yeah, I feel like we've been chatting. I don't know for how long, but
Yeah.
I learned a lot from you. And again, I'm proud of you're my friend. So like I'm proud of
Thanks.
you and it's exciting. And I've been able to witness your journey along this, which I think
Thanks.
is really special and exciting. So
Thanks
I
so much.
appreciate you willing to come on, you being willing to my gosh, you willing to come on
Yes,
and share your
anytime.
experience with
Anytime. And I'm
everyone.
proud of you too. This is
Oh,
so fun.
thanks.
I love watching your little podcast. I think you're so fun to chat with. I knew this would be such a breeze because I'm like, oh, it's Anne. This is so great. It's gonna be fun.
Oh, well, I appreciate that because again, you're this is a whole new thing for me as well. I'm
Yeah.
still learning and I'm meeting so many people and I'm learning so much about different aspects
Uh,
of nursing that I had no idea even existed. So
I love
it's just it's really cool. So, yeah.
So cool. Thank you for all your work
Yeah.
in doing that. I
Well,
think
I
it's important
appreciate
for
you.
nursing, seriously.
Yeah, and that's what I'm hoping to do with this is, people who are kind of feeling stuck or, oh, I'm so frustrated,
Yeah.
nursing is just it's so burnt out right now. I don't want to
Hmm.
do this.
Hmm.
To maybe have an episode where someone hears
Hmm.
aesthetic nursing and that lights a fire.
Yeah,
Nurses are
absolutely.
special and we work hard and we care and our jobs are hard. So there needs to be
Yeah,
some joy in what we
absolutely.
do. And we all need to find our happiness. And it's not always our first
Hmm.
job, right? Like,
Like
and
most of the time, not.
yeah,
Hmm.
exactly. And that's what's so special about nursing is we can go in so many different directions. And
Yeah,
this is just another direction. Own it. Like I consider you a business owner. I don't know if you're
thanks.
allowed to
Yes.
say that or if you've thought of that, but
Yeah.
I do because you have your
Yeah.
own space and you manage that. So you're a
Hmm.
business
Hmm.
owner and you're a nurse, and that's
Hmm.
freaking cool.
Thanks, girl.
Yeah. Yeah.
Aw.
Yeah.
So
But
sweet.
okay, so let's wrap this up.
Okay.
What is the biggest
Um.
piece of advice that you could give to someone, let's say you're already a nurse
Hmm.
and you've kind of thought about this or you're feeling burnt out.
Yeah. The fir-
Maybe even pivot that. Let's say what is the most special thing to you about this specialty?
oh my gosh.
Did I just put you on
Uh,
the spot?
there's so many things. This is totally fine.
Yeah.
You can put me on the spot. The most special thing, honestly, and we touched on it already, is just the impact I have on patients and kind of seeing this all come full circle. And in me giving, just kind of me living the way I am, educating and helping others become successful and helping others feel confident, that in turn just provides this or allows this energy for opportunities to come to me. And I feel like it's full circle. And I feel like that's how we're kind of crushing that stigma out there in the med spa and other spaces because everyone needs to be valued. Everyone needs to have an opportunity for growth. But yeah, just kind of women empowerment in that kind of sense. And then also just my patients. And then being able to utilize my nursing background to be where I am. That is you said that like business ownership and nursing. It's a really unique thing and that is so special to me and allows me to feel so fulfilled every day. So, yeah. That was kind of a long answer,
No,
but
I loved it. It was perfect. You touched on everything that I was kind of looking for, to just kind of maybe
yeah.
be that piece of motivation that someone needs to hear to take
Yeah.
that leap of faith and take a risk. I mean, I've
Yeah.
always said that, travel nursing, which you have experienced, it's a risk. No one wants to pack up everything they own and
Yeah.
leave and go to a
Yeah.
place that they know zero about anyone
Yep.
there or the space and just,
And the patients.
yeah,
Yeah, if
and
you
just
could do
go.
that, you
Yeah.
can definitely bet on yourself and do aesthetic nursing for
Yeah.
sure. If that's something
Love
you're
it.
thinking about. Yeah.
Yes. Well, Ashley, it's been a pleasure. I'm so happy you decided to support me and come on here and record this episode. And it's just I'm inspired. So we'll see where I end up.
I know. You inspire me. Thank
Oh,
you. I had so much fun. This went
I
by
too.
quick, honestly.
Yeah. Well, thank you.
Thanks, girly.
Thank you for tuning in to Nursing Uncharted. You can learn more about this episode and our show on our website at amnhealthcare.com. If you enjoyed this episode, share it with a friend and subscribe to our show on your favorite podcast platform. You can also find show updates and nursing opportunities on our Instagram at AMN Nurse. Special thanks to AMN Healthcare for making this show possible.